everybody, Dr. Britt Talley Daniel MD. I'm a neurologist and headache doctor, and today I'll be talking about do occipital nerve blocks help migraine? Well, migraine is a trigeminal nerve cerebral artery problem with inflammation of the trigeminal nerve and the cerebral arteries, and the migraine produces the neurochemicals CGRP, neurokinin A, and substance P, which cause this inflammation. The nucleus caudalis in the brainstem is also activated by the migraine process, and its fibers go to the back of the head on one side in the C2 distribution. C2 fibers go into the occipital nerve. Persons with chronic migraine, which is defined as at least 15 headache days per month, 8 of which have migraine features, commonly have pain in the back of their neck or head due to stimulation of their C2 fibers. And a lot of people who have episodic migraine will start with headache pain on one side that will then come forward into the temple or behind one eye, usually on the same side of the head. So the question is, do occipital nerve blocks help migraine? Occipital nerve blocks have a long, successful history of helping migraine patients. Steroids and or local anesthetics are injected near the greater and lesser occipital nerves in the back of the head. The injection blocks pain signals and reduces swelling and inflammation in the back of the head and the neck. It's helpful for treating chronic migraine in this area. Related questions. What are the indications for the injection? Well, occipital neuralgia, migraine which hadn't responded to conservative treatment, which is usually chronic migraine due to medication overuse headache, post-lumbar puncture headache, cluster headache, and cervicogenic headache. Where is the injection given? Well, the patient is conscious during the procedure. The doctor uses a 26 or 27 gauge needle attached to a 1 cc syringe and injects in the back of the head at the level of the ears, about halfway from the center on one side. Specifically, the injection is given at the points of the greater and lesser occipital nerves down to the periosteum of the occiput. And the occipital nerve is between 8 to 18 millimeters deep through the scalp. The injection is usually given on one side of the worst patient complaint of headache. Like if it's worse on the right, you give it on the right side. But it will work if given on either side. And it'll also work for patients with pain on both sides of the head or in their neck. I have a picture on my webpage blog at www.drmigraine.com on this, which shows you where the injection is given if you want to look at it. What is injection? What is injected? The doctor injects cortisone for anti-inflammatory effects, such as methylprednisolone and triamcinolone, and a long-acting local anesthetic like lidocaine or bupivacaine. Studies have been done comparing clinical results using only a local anesthetic alone and a local anesthetic plus cortisone drug, and both injections seem to work about the same, and I usually give both. What about patient allergy to cortisone injection? All patients should be queried regarding an allergic reaction to cortisone drugs, and if they are allergic, they should not be treated. Where is this treatment performed? Well, the injection usually is given in an exam room or treatment room in the doctor's office. It's not a big deal, and the side effects, which will be discussed later, are few and mild. Usually a small injection of one of these anesthetics is given first, and the doctor will wait about 5 minutes for the medicine to work and then numb the spot where the full injection will be given later. There's usually no blood loss and no need to use a Band-Aid or even a dressing. The patient may sit up or lie down on their side for the injection. How long does the procedure take? Well, this is a simple, quick outpatient procedure, much like a dental injection they give you for lidocaine. It makes your jaw numb during dental work, and it just takes minutes. How long before resumption of normal activities afterwards? After the procedure, the patient is not usually observed in the office, and they may leave and have no problem driving themselves home and performing normal activities afterwards. How long does the injection take? The injection is usually very quick, 15 minutes usually or so. What are the results of occipital nerve blocks? A recent study found that 80% of patients experience significant to moderate decrease in pain. Long-term statistical studies are needed, but the general experience in neurology and headache work is that these blocks are usually effective. A second injection may be given to patients who respond well initially. And that's usually done after several weeks after the first injection, if the pain comes back for the patient. How long do the effects of the nerve blocks last? It's normal to have numbness at the local scalp injection site since local anesthetics produce this. It's going to be numb. The numbness is like that again, which occurs with a dental procedure, and the duration of numbness is about 3 or 4 hours. Beneficial effect from the steroid takes 3 to 5 days to come on. Doctors should tell the patient that so they're not thinking it fails and nothing's working after a day or so. Pain reduction may last days, 2 weeks, or occasionally last several months. What are the side effects of occipital nerve blocks? The most common side effect is injection site pain, which is short-lived. Other side effects include temporary 6 to 8 hour symptoms of bleeding, dizziness, weakness, and lightheadedness, and there's a very slight risk of infection. So this is my talk on use of occipital nerve blocks for patients with migraine headache and other conditions. Please subscribe down there so we can follow each other, and you can follow me on YouTube for other migraine and other medical videos I have there. God bless all you people who've had headaches like this, and I will see you all again on another talk.